We've known for a long time that hemophilia centers are important to optimal outcomes for patients with hemophilia. In fact, the CDC found that there's a 40% decreased morbidity and mortality in patients who receive their care at the comprehensive hemophilia treatment centers in the United States. And we've known also for many years, those of us in the hemophilia treatment centers, that we can't provide those services without 340B income. But importantly, more recently, the National Hemophilia Program Coordinating Center was able to conduct a survey that demonstrated that the majority of staff support for nurses, social workers, and physical therapists, vocational educational counselors, comes from 340B income. Next, we're going to hear from two very important people. They're both consumers. They're individuals who have hemophilia and who receive their care at hemophilia treatment centers.
When I was small, I probably had the same experience that a kid in New York would have. If I got a bleed, which was, not all the time, but consistent, the treatment was you go lay in bed somewhere, whether it's a hospital or it's your home, which meant you didn't get to be out with your friends doing stuff. So the thing you noticed most, other than hurting every once in a while, was kind of isolation. So having the center, made all the difference in the world.
And so I grew up, I guess, in the first generation really of people that got better care, that went from the older model of getting whole blood or cryoprecipitate and going to the emergency room every time you had a problem to actually having a doctor who specialized in hematology, and which has since then evolved into the entire HTC model.
So in the last 40 years since I've been involved in hemophilia care, the difference in the lives of patients and families with hemophilia and the difference in their health outcomes is really remarkable. In 2016, 2017, we have a completely different story. We have people with severe hemophilia that I follow that are college athletes that are working full-time. We have most of our parents have both parents working. Most of the children don't miss any school or maybe miss a couple days a year just to come to clinic.
Keeping the HTCs viable and with the revenue streams they need to support the hemophilia community is very important to me. It's critical. I've experienced the world without HTCs.
One of the best things that you get when you go to your HTC is you get comprehensive care, which is also called integrated care, and really it just means that you have a full team at the ready to take care of you in one single office visit.
The people working there have developed such an understanding of hemophilia and the challenges it brings to not just the hemophiliac, but the family.
You can go to your state capital and talk to your representative, and here you are saying that here's funding that actually has a return, that actually can save the government money and help them balance their budget.
We're not expecting everybody's going to rush to the Capitol to convince their congressmen or their state representatives that this is the way to go, but everybody has contact with the insurance company. They're going to know what saves them money. Without comprehensive care, you're going to have more bleeds, probably more severe bleeds, and you're going to have complicating factors, other things going wrong because of bleeding that can drive up the cost of health care.
You should probably talk to someone at your next visit, whether it's the nurse or the social worker, whoever you feel comfortable talking to, and saying, what is a 340B and why should I care? And you'll probably have some eye-opening answers about what that HTC does, what it means to you.
There is an emotional component to a relationship with an HTC. When you have family members that are being helped, especially grandchildren, it adds a new dimension to that. Whether you get factor from the 340B program or not, you're going to be taken care of at the HTC. Everybody's benefiting from the comprehensive care model, but it has to be paid for.
It's very important to me that HTCs exist to not only continue to take care of me as I get older, but to take care of my children and my grandchildren.